Good day, everyone, and welcome to my new YouTube channel. I'm Mercy by name, but friends and family call me Madam Portable. Let's leave the Madam Portable for some other time. Since you are subscribed to my channel, I'll tell you how that name came about. I'm married and I reside in Nigeria, Edo State precisely. Sorry, English hard though. I'm a university student in the University of Benin studying pharmacy. In this channel, I'll be bringing to your screens healthy lifestyle, how to live healthy, how to manage conditions you find yourself in. I'll try my best to bring in very interesting and educative topics to this screen. So please do well to subscribe to my channel, please. And I will appreciate that if you just hit that notification bell. Thank you. So in this video, we are going to be talking about hives, urticaria. Hives. Well, these are conditions that I find most commonly around myself and around people. Actually, I'm also a victim of this condition, so that's why I'm bringing this as my first topic on my channel. If you have ever seen patches or rashes on someone's skin, or rather your skin, in form of itchy wells, I'll put a picture on this video and you will make reference to that video picture. So if you have ever seen something like that on your skin, or either on your skin or anyone's skin, those are known as hives. They're also called urticaria, and they are skin allergic reaction. They cause itching welts. So this urticaria can be chronic or acute. Chronic meaning that it will last for more than 6 weeks and often return after months or years. And in chronic urticaria, their causes are idiopathic, meaning that their causes are not known. But in the other one, acute urticaria, acute urticaria can occur because of certain or many reasons, and there are various causes of acute urticaria. So please, let's listen as we take on the lecture, learn the causes, the symptoms, the treatments, and home remedies for this condition. Years back, the first reaction I got for urticaria was very strange. I just woke up one morning and had this swollen lip. I couldn't go to school that day. My lip was so swollen. I was so embarrassed. When I woke up and I checked myself in the mirror, like, what was this thing? And this thing kept on itching me. And the more I was itching it, the more it was getting swollen and swollen. So I missed classes for that day. This thing was just there, but the normal knowledge I had of drugs, so I just took something, an antihistamine, to reduce the itching. This is the common Piriton that we know. So I took it and the itching went down. Then I kept on having these reactions all over and all over again. So I had to visit the dermatologist. I went to the hospital and they found out that I had urticaria, which is in hives. Now, there are various things that can trigger this urticaria. Some of it is allergic reaction due to something you put on your body, maybe the kind of cream or the kind of soap you use on your body. This skin reaction called urticaria is very, very sensitive to scented products, especially soaps and lotions. Once you are using a scented product, this allergic reaction just keeps on coming all over and over again. Another thing that can trigger your allergy is food or drink. There are some people that don't take certain food, they don't take certain drinks, because once they take it, they will just trigger this allergic reaction. And sometimes it might be something you touch. You could just touch maybe this pet dander, this flaws from pets. Once you touch it, to trigger the reaction, and before you know it, you start having an attack. So how does this allergic reaction happen? This happens when you have allergens. Allergens are the things that trigger these attacks. So what are allergens? Allergens could be the drinks, the food, the lotions you use on your skin, the soap you use to bathe. Maybe you have a pet, the dander enters your nose, and anything can just trigger it. So you have to know what triggers your allergy. So how does this thing happen? It happens when the skin immune system, called the mast cells, the mast cells are the ones that are triggered by this allergen. Once this allergen gets into your system and the mast cell picks it up, so these mast cells release some certain chemicals once they pick this allergen. And one of the major chemicals that is responsible for this particular reaction is histamine. Histamine does this and is responsible for the hives that is formed. I also put a picture on this video of mine of when I had my own, I think that was last week. I had an attack last week and I could barely I could even barely know what I was doing then. I was just itching and itching and itching until I figured out that this was what caused this allergic reaction, and I had to just leave that place at that moment. So this urticaria actually can also be due to other causes like infection, stress, physical stress on the skin. When you apply pressure too much, for people that have this reaction, this condition, once they apply pressure on a particular side in their skin, on a particular part of their skin, you notice this welt, swelling, itches. If I should press my cheek right now for long and I hit it, I'm going to notice that. If I should actually apply pressure on my hand and like use my nails to stroke my hand, before you know it, I'll start seeing this allergy in my skin. That's just a skin patch test to know that you actually have this condition. Sometimes it is also uncommon to know the cause of these hives. Yes, it's very uncommon. You should know the cause. Once you know what triggers your allergic reaction, then you know that, okay, I know what causes my reaction, and you have to avoid them. Okay, there's something you should know too. This condition is not contagious. It's not contagious at all, though I know it's a skin condition, but you can't contract it by touch or by sharing utensils or sharing anything. You can't contract it that way. So let's dive into the treatments for this allergic reaction. Most times they do go away. They do go away on their own. You just have the allergic reaction, you know what triggered it. For example, you can just have the reaction at this particular place, and you know that it seems the weather condition here, or the particular place I am is too cold, I need to leave here. Once you leave, you see that the reaction comes down. That means yours is triggered by certain change in temperature. But most times these natural remedies cannot actually regulate these attacks. In that case, you have to see your healthcare provider. Sometimes the healthcare provider will recommend medications orally or by shot intravenously. These medications will help you feel better, and they will reduce the consistency or the frequency of the attacks. So some of these medications are antihistamine drugs. If you have heard about a drug like loratadine, yes, it's an antihistamine. So this antihistamine, what do? They inhibit the action and inhibit the certain actions that histamine brings to play. So once these allergens trigger the mast cells, these antihistamines block the action of histamines, which is responsible for the hives formation. So the antihistamines help to cut off that action of histamine. Examples are loratadine. Piriton is also an antihistamine. There's one I always take, the one the doctor recommended for me specifically. Though in those years I take them almost every day, but now I know what triggers my allergy, so I don't take the drug most times. And this is levocetirizine dihydrochloride. I'm going to be showing you this drug. It's called, the brand name is called Zagzai. Here it is, Zagzai. See, levocetirizine hydrochloride. It's a very good antihistamine. You can see I've taken just one tablet from this, and I bought this for over 3 months. I've reduced the way I take the tablet because I know what triggers my own condition. My own condition is normally triggered with cold environments. Actually, I notice that most times when the AC is on in the room, I start getting this reaction. Once I stand up and leave that place, it goes down on its own. Sometimes cold water, I don't go close to cold water because it also triggers my own reaction. Apart from these antihistamine drugs, there are topical steroid creams. Yes, topical antihistamine steroid creams that doctors can recommend, and it will help you to manage this condition at home. So let's talk about natural preventive condition and natural preventive methods you can use in the house to manage this condition. Now, if I know that this certain food I eat triggers my reaction, definitely I have to stop eating that food so that I won't get this reaction back. So you have to cut certain food out of your diet. Cut certain food out of your diet. That will help you to curtail your reaction. Also, if you are the type that your reaction is triggered by pet dander or anything or dust, you have to stay away from those places. When I newly started my business of selling poultry feeds, I was always going to the hospital every weekend because the dust from the feed and the rest, I always inhale them. You see, apart from cold, I figured out another allergen, which is the dust from the dander from those from the feeds I sell in the shop. So anytime I go to the shop in the evenings, I get this skin reaction, I start itching and the rest. So I was always visiting the doctor then too, and I found out that I was actually reacting to the poultry feeds I was selling. So then I had to start using nose masks when going to the shop, and the doctor actually recommended I always cover my nose so that I'll stop inhaling those things. And actually, after then, the hives reduced drastically. So you should know your allergy, know what triggers yours, and prevent it. Then, like I said, this condition is actually a very sensitive condition. It doesn't agree with smell, with scent, or anything at all. So you should have to switch to detergents and soaps that don't have scent and dyes. Stay away from scents, stay away from dyes. Yes, at a point I stopped using perfumes because once I inhale the perfumes, before you know it, it triggers the reaction. Yes, I'm a lover of perfumes, but at that point, when this thing was really serious, I dropped all my perfumes, and yes, it's actually improved my condition. I was not having the allergies so much. So you have to also wear loose and fitting and wear loose fitting, lightweight clothing. Don't wear something too tight so that you not apply pressure on your skin. Also, oatmeal is very good for this condition because oatmeal has soothing properties and anti-inflammatory properties. This skin condition results to inflammation in the skin, so it's good to include oatmeal in your diet. You can take oatmeal, you can make normal oats, white oats, and eat. You can eat oats as groceries, and you should also use oatmeal baths. Yes, excuse me. There's this St. Ives oatmeal baths I do use, though I don't have the oatmeal bath now, it's finished, but I use it and it suits my skin. For now, I am also using St. Ives oatmeal and shea butter lotion. I have it here with me. This is it. This St. Ives oatmeal and shea butter lotion. This lotion is very soothing for my skin. It's very soothing because I feel it whenever I take my bath and I use this lotion. I just feel that my skin just maintain that calm composure, and I feel so cool in my skin. So knowing that this thing is really helping this condition very well. So please try to include oatmeal in your routine, in what you eat and in what you use in your body. When should you call your healthcare provider? When you notice that this skin condition keeps on repeating, even when you try to use your home natural remedies and there's no solution, there's no improvement, please see your healthcare provider. When you have swollen lips or face consistently, try to see your healthcare provider. When you have hives that even last more than a week persistently, please see your healthcare provider. Also, when you have severe itching that might keep you from sleeping at night, try to see your healthcare provider because there might be other underlying conditions that you don't know that is causing these hives. So we've actually educated ourselves now on this condition, believing that we'll be able to manage it very well, believing that even those that had it before and didn't know what it meant, once they watch this video or come across this video, they will know what urticaria or hives is. And for those that have seen this condition among people around them, they will be educated to know that, oh, this condition is actually hives and I know something about it. I know it can be managed. Thank you so much for watching this video to the end, and please don't forget to subscribe and hit that notification bell, please. I really need your encouragement. Thank you, and see you in my next video.